So I'm going to go ahead and share my screen. And then students, you can let me know when you're ready for me to advance the slide. Let me just make sure. Do you guys see the orange screen? Okay. And okay. Jerry, it's actually, I can quickly go over no, I thought we had our objectives, but we didn't. Okay, we're going to just give you an overview of diabetes. So take it away, Jerry.
All right, so hi everybody. I'm sure we've all heard of diabetes, but what exactly is diabetes? So broadly, diabetes is defined as having too much sugar in the blood. When sugar stays in the blood, the body isn't able to use that sugar for energy. It stays in the blood and it can cause damage to other parts of the body. So why is it staying in the blood and not getting to the cells where it can be used for energy? Insulin is the important hormone in our body that primarily allows sugar to move into the cells. You can think of insulin sort of like the delivery person of the body. Insulin delivers sugar to the cells the same way a delivery person delivers packages to the home. If there are too many packages for the person to deliver, or they can't efficiently deliver them, then the packages build up. In other words, there's too much in their mail bag.
Jerry froze and we lost him. This happens periodically with his internet. We'll see if it looks like he's still on. Okay. Jerry, are you still there?
Hear me?
Oh, we can hear you now. We can't see you. These are the issues of today, right? All right, so I'm going to kind of take over for Jerry. Oh, we can't see you, but we can hear you. Although it says you're on mute. There you are. I can see you now. But you're frozen. I'm not the one frozen, right? It's Jerry. Okay, there you are, Jerry.
Can you hear me?
Yeah, we can hear you now.
I can't hear anything.
It's so odd though, because it says he's muted. Okay, so I'm just gonna pick off where Jerry left off and then he can, this is, we just gotta be ready for these things. So we talked about insulin being very much like a delivery man, right? Insulin is the hormone in our body that delivers the sugar from our blood to our cells. And you have to picture it like that delivery man. And if there's too many packages for that delivery man to deliver, they're overwhelmed, they can't do it, they don't work as well as they could. There's basically too much in their mailbag. The other scenario, like the type of diabetes where there is no insulin, is there is no mailman, there is no delivery man. And so that sugar just stays in the blood waiting to be sort of delivered to the appropriate place. There are two types of diabetes. There's type 1 and type 2. The difference between the two are whether your body is, in type 1, your body is not making insulin at all. And so there's no way for that sugar, again, to be sort of transported into those cells. And then in type 2, it's really when the body is unable to utilize insulin efficiently. And so there is insulin there, there may not be enough, or it's just not working as well as it should. That type 2 is what is sort of developed over time. We often see it due to obesity or lack of exercise. This is where we see a lot of our medications used and is the more common sort of type of diabetes. So healthy lifestyle can definitely help with that type of diabetes, which is what Heidi will talk about. Type 1, people are typically born with that. People can develop it later in life, but it's typically seen in very young children. It's usually diagnosed. I don't think Jerry's back, right? I'm wondering, did he do this on purpose? I'm just kidding. So when we think about how would I know if I had diabetes, right? What does diabetes feel like? How would someone even know that this was happening? So it's not like pain, right? Like you wouldn't necessarily know that you have it, but some things people may experience are being more hungry, more frequent thirst, feeling thirsty, having to urinate more often, potentially blurry vision. It's not common that someone says, I feel different, maybe I have diabetes, right? Like typically diabetes is diagnosed through a blood test. So the patient will go to the doctor, they'll do a fasting blood test, so having not eaten, they'll test their level of blood sugar with expecting very low levels because there's no food there to sort of be producing that sugar. And so they're looking for that range, and that normal range is less than 100 milligrams per deciliter. And that's normal. There's also a number called an hemoglobin A1C. That gives us a picture of the patient's diabetes over a 3-month period. So once someone is diagnosed with diabetes, they'll watch that number to get an idea of how the diabetes is either progressing or is getting better. Okay, so now I think we can pass it to Chantal.
So now we're going to talk about the dangers of diabetes. So there can be danger when there is either high blood sugar or low blood sugar. So when there are high levels of sugar in your blood over long periods of time, it affects how certain parts of your body work. Too much sugar can damage your blood vessels and nerves. This can lead to heart attacks, strokes, kidney damage, as well as nerve pain. It can also decrease blood flow to your feet and damage the small vessels in your eyes. If you have diabetes, it's very important to see your doctors regularly, including an eye doctor and a foot doctor, and they will be able to detect if there is damage occurring. And if your blood sugar is well controlled with diet, exercise, and medication, this damage can be prevented. And for low blood sugar, some medications used to treat diabetes can cause your blood sugar to become too low. This can be very dangerous. Some signs and symptoms include sweating, feeling tired, dizziness, feeling shaky, or a fast heartbeat. It is very important that you know how to deal with low blood sugar. Some ways to treat this are you can drink a regular can of soda or some orange juice, eat a candy bar, or 3 to 4 glucose tablets. And if you have diabetes, you should keep one of these things with you at all times.
So I know at this point, you guys are all probably thinking, what can I do to help? Diabetes is a very complex disease, and there's a lot to learn and continue to learn throughout your treatment. So we recommend you use your healthcare professionals and local support groups to better understand the disease. They're both really good resources for knowledge and personal experiences that you guys can relate to. Sometimes people with diabetes can feel very overwhelmed and frustrated, but you really shouldn't have to go at it alone. Weight loss, even though it's daunting and very hard to do, even a small amount of weight loss can make a huge impact. Setting an initial goal of just 5 pounds and you will notice the differences will be worth it. Same with physical activity. The weather's getting warmer out now, so just try to increase the amount of time that you're moving throughout the day. Take an extra 20-minute walk. Use the stairs instead of the elevators. When you go grocery shopping, park a little further away from the store entrance. It's okay to start small. We're really not expecting it to be a drastic increase and work your way up from there. Trying to decrease smoking and alcohol intake. These can both increase the risk of damage caused by diabetes, and ultimately it would be best to quit smoking and alcohol altogether, but just trying to decrease it as much as possible. And finally, monitoring your blood sugar is important as it can help to prevent complications from either a too high or too low blood sugar.
So we're going to go a little bit about the medication very lightly, not too intricate here. So there are many different types of medication to treat diabetes. They all work in different ways. Some people use insulin, and the insulin replaces the naturally produced insulin in our bodies, allowing that blood sugar to get into the cells. Other medication help lower the amount of sugar made by our bodies. Some help the body produce more insulin, and other helps our body use the insulin more effectively. The medication that are prescribed for you are customized for you. The doctor considers many different factors when choosing your medication, such as what conditions you have, your lifestyles, as well as the cost of medication. You also have a say in the treatment regimen. Some medication are injectable and you may not like to inject medication. Some medication are taken multiple times a day, which may not fit with your lifestyle. So this is a conversation that you should have with your doctor and pharmacist. So some of the most common oral medication used to treat diabetes is metformin. So this medication, it works by making the body more sensitive to insulin, allowing it to use the insulin more effectively. This medication is taken 2 to 3 times per day with a meal. A common side effect of this medication is diarrhea. There are several other medications that can be used, like we mentioned. If you ever have any questions about your medication, just be sure to ask your pharmacist.
Okay, so oftentimes patients will start a treatment regimen for their diabetes and have some questions. One of them is, well, now I'm on medication, so this will take away my diabetes. This will sort of cure my diabetes. That's not what happens. This is sort of, the medications sort of allow your body to live with diabetes, right? So they're taking that sugar from the blood, getting it into the cells so that the body's able to function as it needs to. But the diabetes doesn't go away. Weight loss and lifestyle changes can help diabetes go away. We've seen patients come off of medications. I remember a patient that I talked to at Hannaford one day was sharing with us how she was on multiple medications for her diabetes, was able to lose 80 pounds, which, whoa, okay, and came off of her meds, like was actually cured of her diabetes. So it's not impossible, but the medications do not do that. So how long will someone need to be on their medications? As long as they have diabetes, right? So as long as they have diabetes, they need to be on the medication to help with that blood sugar. Could they come off of some of them and just be on some? Yes. Could they decrease their doses? Yes. But as long as they have that diabetes, they're going to need to be on medication. Another common misconception is, okay, well, now my blood sugars are good, my numbers are good because of the medication. So now I can sort of go back to my old eating habits. I can go back to eating a bowl of cereal before bed, or, bagels every morning. That's not true, right? It's just going to keep sort of layering and making the diabetes more complicated and potentially more difficult to treat. So just because it's well controlled with the medications doesn't give someone sort of a free ticket to eat whatever they would like. And then what if they don't, what if someone doesn't like how their medications make them feel? Excuse me. This is not uncommon. Every medication comes with an adverse effect or a side effect. Every medication. There isn't one that doesn't have a side effect. You need to talk to the pharmacist. Talk to the pharmacist, talk to the doctor. There are alternatives to every medication. So if there's a side effect that is really affecting your quality of life, we will make it better. We'll try to find a way to maybe find an alternative. It could just be a matter of when you're taking it during the day. If you're taking it with food, without food, we could try to find a different formulation of the medication to help it be released in your body a different way so that it doesn't give you the side effects. Go ahead, Alex.
And lastly, we're going to finish up with vaccines. With diabetes, your immune system may not work as well. So because of that, it's very important that you get the vaccines that are recommended for you when they're due. Some vaccines that patients with diabetes are recommended to receive are influenza vaccine every year, the pneumonia shot, hepatitis B, zoster, Tdap, the COVID-19, and HPV. The good news is that many of these vaccines can actually be given right at your local pharmacy. So if you ever need one of them, just stop on by. If you aren't sure whether or not you have received them or need any of these vaccines, talk with your doctor or pharmacist, and we can make sure that you're getting everything when they're due.
So that's what we have for the pharmacy portion. Are there any questions? Ryan, you're our one and only honored guest. Do you have any questions about this?
Nope, very well done. Well presented.
Okay, good, excellent, thank you.
Cheryl, I just wanted to make a comment before I start, and that I'm really glad you brought up that idea that just because you're on a medication doesn't mean you can suddenly eat more sweets or carbs. And I don't know if this is the right way to phrase it, but sometimes I feel like people are like chasing the numbers with just covering, like layering more medication to cover their extra, sweets. I've actually had conversations with folks about this gently, right? Because they may be a little defensive about that, but I don't know if you can speak to that a little bit, like just that technically, right, the medication would help with that, but over time, would that cause more complications?
Right, and so the medication can only go so far, right? So we talked about how some of the medications work and that they help the insulin to work better. But if the diabetes continues to sort of exist, eventually the body's not going to make insulin. And so those medications aren't even going to work anymore. So that takes away options. There's still potentially damage occurring. This is where that A1C number is really valuable as a practitioner, because we can see the big picture. It's not just those finger stick numbers, right, over time. So you're right. While that morning may be okay because you gave yourself extra insulin so you could eat the donut, over time continuing to do that, it doesn't work.
Yeah, for sure. Do you guys ever get questions about the devices? That was the other question I had, the blood sugar monitoring type devices, or that would not necessarily be a pharmacy question?
No, it would, because they get prescriptions for them, and they come oftentimes to the pharmacy with prescriptions for the strips and the lancets. And so it's not uncommon for us to have to walk a person through how to use it for the first time. There are also different ways. There's a lot of insulin pens, so they come in a device to be able to give the insulin. And there's also injectable diabetes meds that are not insulin that we have to consult patients on. But yeah, the devices, they're all a little different. Each one is a little bit different as far as where you put the blood, where you insert the strip. And so we just encourage patients, if they're not sure, to just ask us, because we can definitely help them with that.
Yeah, that's great, because I'm sure they only get so much time with the doctor, and then you're at least an extra resource as well, even just to clarify things, because there's so much involved with patients. So thank you for that. Awesome. All right, well, I will start my portion here. I'm just going to pull up slides. Okay. All right, can you guys see my screen? It says diabetes. Yeah, okay. Okay, so I'm going to advance a little bit, because you guys already covered quite a bit about just the overview of the disease. Basically, the goals in this class were, identifying some of the risk factors, understanding the differences between type 1 and type 2, the role of diet in controlling blood sugar, which is the part I'm going to be going into more deeply, and then discussing some tools for healthy shopping for diabetic friendly foods. So I'm going to skip through the beginning here, because we already talked about this part. You did a nice job there. I may just stop here and review this real quickly, because we talked about type 1 and type 2, but kind of along the same lines, and even before somebody is possibly diagnosed with type 2, they would probably be given a diagnosis of prediabetes. And this is where it would most likely be diagnosed from that A1C number that Cheryl was talking about. I find this to be a really key time to intervene and start looking at the diet, nutrition, and whatever else can be done before somebody possibly develops type 2 diabetes. So I think this is a really critical point for any practitioner or doctor to really kind of let that patient know that, we can do the best we can. We can't always prevent that progression, but a lot of times we do see a prevention of the diagnosis of the full-blown type 2 diabetes. Type 1, as Cheryl mentioned, is what we would consider autoimmune, where the body's just not making any insulin. So that's not something that you can necessarily prevent. Gestational diabetes would be the other common type of diabetes that we see in pregnancy. And diet can certainly be modified. Certainly, that would definitely be a time for someone to see a dietitian, because they want to factor in everything that's going on with the pregnancy and the medication management in that case as well. Okay, scroll through here until, okay. So you guys kind of already talked about risk factors. Sorry, and I just want to, okay. So here we are. So if you can see my slide, it says important reminder. So type 2 diabetes is sometimes called an illness of the environment. which means that there are a lot of things that you can do to lower your risk and create a safe environment for yourself, even if there are factors that you can't control. So essentially, there's a lot that you can control to help prevent the progression of that disease, or even to kind of stall the diabetes. And I think you said, Cheryl, like put it in, not put it into remission, but sometimes like the diabetes almost goes away, more or less. So we consider it more of the preventative type of diabetes. So let's talk about the nutritional components for somebody with diabetes. So I want to start out by talking about what we call macronutrients. So these are the main components of our diet. When we look at our plate, we typically have carbohydrates on there, proteins on there, and some good fats. Those tend to be the main food groups, essentially. So even though I'll be talking more about carbohydrates as it relates to the blood sugar management, I will also address the proteins and the fats and how we should have a balance on our plate of all of them. Okay. So we first need to define which foods contain carbohydrates, because that's what when somebody does come in, have a diagnosis of high blood sugar, diabetic or not, they are typically told to watch the carbohydrate intake. So we first need to really know which foods have carbohydrates. And then, like I said, also look at the foods that don't have carbohydrates and how they fit on our plate. So foods that would be considered a protein would be anything that's a meat. So fish, chicken, red meat, turkey, and then eggs. And also some beans would be considered a plant-based protein. These are a little bit tricky as far as classifying them, because they have some carbohydrate and protein. So they're kind of considered both. Okay. And then, as I mentioned, if we're looking at a person's plate and the different food groups, we also do want to consider the types of fat that are in their meal or on their plates. And this is really important as well, because I forget who it was that mentioned that heart disease was a risk factor when you guys were talking through your slides. But it's really important to note that if you have diabetes, you are at higher risk for cardiovascular disease. So this is where the heart healthy fats are really important. So this just gives you an overview of the types of fats. We have monounsaturated and polyunsaturated fats. So these tend to be our plant-based fats versus something like butter, which would be coming from an animal source and would be considered more of a saturated fat. So, and then there's omega fats, we have omega-3 fats, omega-6 fats, and there's some examples here: walnuts, flaxseed, fatty fish like salmon, and some vegetables. So I would say with fats, there's a lot of different terms, but essentially just think of them as heart healthy and not so heart healthy. So I have some examples here actually that I wanted to show you. And this is a product that we just started carrying not too long ago at Hannaford. Hopefully you guys can see that. It's very exciting to see avocado oil, the store brand. You guys hear me okay? I see you nodding, Cheryl. Okay, good. So
I'm very excited about avocado oil.
Yeah,
I didn't know
so
Hannaford
this
had
is really
their own.
cool because we have it in our store brand, so it's more economical and really still good quality. So you can certainly eat avocados, but you can also find it in different forms like this too. So this would be a very heart healthy choice, and it is high in these monounsaturated fats. So you don't have to get too hung up on which ones are mono and which ones are poly, because most foods are going to have a combination of both. If you look on the label, sometimes it does show that, sometimes it doesn't, but just kind of start to learn which ones are more heart healthy and which ones aren't. Okay, so I want to go back to the carbohydrate conversation before I move forward. So I'm going to stop and I'm going to pull up another screen.
Can I ask you a question while you're doing that?
Sure.
So
Yep.
Can you use avocado oil like you can use olive oil, like in cooking, or is it
Mm-hmm.
It's just like, and is it a healthier option than olive oil?
That's a great question. I mean, I still use
Is it
olive
like-
oil. I think it's just,
Yeah.
I like to, with the fats, I like to, and cooking oils, like to have kind of a variety in the pantry because some recipes lend better to one or the other. So an important thing to know with any oil that you're using is the smoke point, and essentially how high, what temperature you can cook it at. So this just says, you know, there isn't a lot on the label here on the exact temperatures, but it just says great for frying fish, cooking vegetables. So it's very versatile. I could look up more specifics.
I use avocado oil when you cook chicken because, like Heidi said, it does have a higher smoke point, so it doesn't burn.
Doesn't burn. Yeah.
Olive oil does.
Olive
Higher
oil,
than olive
exactly.
oil
That's
is?
kind of
Yeah,
the
it's
tricky
higher than
part with
olive
olive oil.
oil.
It can burn at, if you have your pan any higher than like medium, you have to be careful with that. And don't get in the habit of, you know, preheating the pan like really high and then trying to turn it down, because sometimes it just gets too hot and then the olive oil will smoke. Yeah, that happens. It's happened to me anyway.
Me too. Yeah.
Yeah. Yeah, but there's a lot of options when you're looking at the cooking oils in particular. So as I was starting to say, I have olive oil, I have sesame oil, I have avocado. Sometimes we use butter for certain things. So I try to, you know, keep it heart healthy, but also use what lends and flavor to that particular recipe. Okay. So I am going to ask your participation. So hopefully you guys are up for this, but I want to see what you guys know already about carbohydrates. Can you all see this? Give me a thumbs up if you can see the screen here. Okay. So do you think you can match the food on the left with the correct amount of carbohydrate? So obviously all of these foods contain carbohydrates. Like I said, we have to know that first. It's not only bread and pasta. There's a lot more foods that contain carbohydrates, but maybe you guys want to take a stab at the first one. Do you think 1 cup of raisin bran and 1/2 cup of milk is 76 carbs, 70, 52, 45, 131? I think actually I have to scroll down here. Not letting me scroll. 131 or 38? Oh my gosh, 38 or 27. Anyone want to guess?
Go 38.
38? You can unmute yourself.
I'm going to guess 45.
45. Sorry, I was just trying to pull up my
52. I don't know if I'm
52.
back.
Who said that?
I don't know
Jerry.
if my audio's back.
Yeah,
Oh,
we
yeah,
can
I can
hear
hear
you
you.
and we can see you.
I'm
Welcome
sorry.
back.
So you are correct. It is 52.
He comes back and just takes the steal.
Yes. So I'll stop you there. We'll stop the guesses there.
Yeah.
So 1 cup, remember, that's important, especially with something like cereal. 1 cup, most people, I think they're not always honest about this, but they're like, oh, I definitely only have 1 cup. And you also need to think about the size bowl that you have, that you're eating out of, right? I know in our cabinets, we have the really deep bowls, the mid-size, the really tiny ones. So if you're trying to watch your portion, sometimes eating out of those really small bowls can just help you to start. And then 1/2 cup of regular cow's milk, right? So those are the key phrases here. It's only 1/2 cup, which would be somewhere around 6 grams of carbohydrate, and then the cereal itself. So it would be 52. So if we wanted to cut the carbs back, anything we could do there?
Use
Any
like
ideas?
non-fat milk.
Well, that would cut the fat down. It wouldn't necessarily cut the carbohydrates down unless we were choosing a milk. Like sometimes the plant-based milks will have fewer carbohydrates. If that's something that you want to try, you do want to watch that doesn't have added sugar, or else you'll kind of shoot yourself in the foot, so to speak, with that. So definitely that's where you got to read the labels. One thing that you could do is maybe add just a little, well, you could try a different kind of cereal that doesn't have raisins is one suggestion. The raisins are really where you're going to get a lot of carbohydrates packed in there because they're dried fruit. So you could do like bran flakes with some berries, some actual fresh berries instead of dried, and that's going to have fewer carbohydrates. So that's one suggestion. Okay, so how about B, bagel, a full bagel here, okay, because it doesn't say half. So full bagel with 1 tablespoon of jelly. How many carbohydrates do you guys think? Is it 76, 70, 45, oops, 131, 38, or 27?
76.
76?
That's my guess.
That's your guess? Anyone else want to guess?
70.
131.
Someone said 131?
I'm
So
saving that for the piece of cake.
So it is 76 is the answer to that one. So bagels pack a lot of carbohydrates in, right? And you could try and do half a bagel would be one strategy. I think another really good way to modify that would be do like half a bagel with an egg on it. Now you're getting some protein in there, okay? Or half a bagel with some peanut butter. You're going to get protein and fats in there, right? Versus all carbohydrates. Bread, which in the bagel is very thick, right? So it has a lot within the bagel, and then you're adding jelly, adding even more carbohydrates. So that's definitely really jam-packed with carbohydrates versus like an English muffin or a whole grain bread or something like that.
Heidi,
Right.
what do you recommend for like a goal amount of carbs per meal? Do you give people like
I'm
whether
going
they're
to get
diabetic
to
or
that. So
not?
hold on to
Okay,
that
sorry.
thought. I will get to that. Thank you, Cheryl.
Okay.
For asking that though. That's a great question. Okay. So C, 8-ounce glass of orange juice. How many carbohydrates do you guys think? Is it 70, 45, 131, 38, 27? Oh, sorry. 45? Anyone else?
38.
38?
What'd you say, Sandy?
27.
27.
27. Oh, this is fun, isn't it? So it is 27. Yes.
Oh, less than I thought too.
Yeah. So and 8 ounces though, once again, consider the portion. So what size glass are you drinking out of? I mean, right now I have my water glass and I'm actually not even sure. Yeah. I mean, Cheryl has her Nalgene. So
32 ounce.
probably like 16, but I wouldn't pour orange juice into this glass. So once again, you really need to think about what's in your kitchen that you're serving. This is really key when it comes to portions. People are just not aware of how that impacts how much they serve themselves, right? Unless they start counting. When somebody is told by their doctor that their blood sugar is high and all of a sudden they have to pay attention, it's like their eyes are opened, is what we often see. So an 8-ounce glass is 27 grams. And this is something that enters our bloodstream very quickly. So what could you choose instead of the juice that would be similar? What could you choose to help your blood sugar?
Water.
Well, water would definitely be better than orange juice, or you could dilute your water, right? Dilute the juice with water is what I mean. You could just eat a small orange too, and that would enter the bloodstream more slowly because of the fiber, which would bring up the blood sugar more slowly. So it still has the carbohydrates, but it may not bring up the blood sugar as quickly. So for the sake of time, I don't think I'm going to go through all of them, but why don't we tackle the 3 by 3 inch piece of frosted cake? Let's see if you guys get that. So we know it's not 76. We know it's not 27 or 52. So is it 70, 45, 131, or I think, or 38.
131.
You said
How much
131.
frosting? Is it like?
That's a great question. So my answer key actually says 45.
What?
I know. Now 3 by 3 inches though isn't that
That's
big.
true.
Yeah. And this isn't totally descriptive, right? It's more generic. Like we don't have the brand or the label in front of us. So definitely being aware of that, depending on what kind of cake, like you said, if you're at a bakery and it's piled high, you know, this is going to be probably all over the map versus something that you get that's just a single small little piece, like, you know, depending if you make it yourself or what you're using. There's so many variables. So you want to know which one is 131, because we're not, actually the 16-ounce chocolate milkshake is 131 grams of carbohydrates. So certainly that is going to be really throw our blood sugar off the charts. If we're, and maybe one strategy is share one, right? If it's something that you have very occasionally. 16 ounces is, I mean, decently big. I don't have a glass in front of me to demonstrate what that looks like. But once again, that goes to the point that even when we're at a restaurant or somewhere, we often don't know the portion size that we're being served. So you really need to pay attention to this. Okay, so I'm going to stop this screen share and go back to my slides. Thank you for participating in that, though. I think it's fun to engage in a little bit of guessing here and sort of testing your knowledge. Okay, so we'll advance here. So how do we control blood sugar and what is the role of our diet? So I've alluded to some of this. We need to choose the right kinds of carbohydrates. So that's the example of the juice versus the fruit. So there's a wide range of carbohydrates. Some are more processed. We sometimes hear that term processed or refined carbohydrates, like the sweets and candies and cookies and things like that, or white bread versus whole grains, whole grain bread, things like that. So we need to really understand the portion sizes and the grams of carbohydrates, as I was just sharing. And we also need to understand what kinds of carbohydrates that we're choosing. Then we need to learn how to combine our protein and fat and carbohydrates on our plate to make more of a balanced meal. And then we really need to look at fiber, because that, once again, back to the example of the juice versus the fruit, the fiber is what's contained in the fruit that's helping to slow down the release of that sugar into our bloodstream. So as it says here, aim for foods with at least 3 grams of fiber per serving. That's a really good, way to just hone in on what you're choosing when you look at the label. Okay. So an example of a high fiber food that I have here, I wanted to show you, would be, so does anyone do oats or oatmeal or steel cut oats? So I have the, my favorite, looks like a paint can. This is like the original Irish oats. My husband bought these recently and was like, we haven't had these in a while. So this is an example of a whole grain product, right? Versus like even a lot of the cereals that are out there are very processed, and this has nothing but oats in it. Certainly you can buy the quicker cooking kind, that just have been, they're kind of softened a little bit, so they'll cook a little faster. But this is just plain. So you want to maybe add some fruit to it, or add some cinnamon or flaxseed. There's a lot of things that you could add to make this flavorful once you cook them. But this is like kind of one of those superfoods that you often see recommended that just has so many health benefits and certainly a lot of fiber. So I wanted to just point that out. Okay. So let's talk about reading food labels and how we actually count for carbohydrates. So you guys were guessing the grams of carbohydrates in those different foods. But when we look at the label, this is how we can really start learning, right? So another question I like to ask, if you want to participate and share, where is the first place that you look when you look at a food label? Anyone?
Serving size.
Serving size. Okay. So I know it tells you here, but if it didn't say that, I'm curious. Does anyone look at another part of the label? And it's okay if you do.
Calories, I would say.
Calories?
Yeah.
Okay. Anyone else? sometimes people say carbohydrates, or they might say protein, sugars. I think this is when I ask that question, it's kind of a reflection of what somebody is trying to do with their diet, like their goals, right, for their nutrition. Because if they're trying to get more protein, they're typically looking at protein. If they're watching their blood sugar and maybe their weight and their overall diet quality, they might be looking at this added sugar line. If they're concerned about their blood pressure, they might be looking at sodium. So certainly we kind of want to try and look at all of it as much as possible. But I know we tend to hear when we're in the store working with customers and getting emails and inquiries that people tend to be a little bit confused about the nutrition facts panel and what to look at. So you definitely want to check the serving size first. And this is an example of an updated food label where the font was made a little bit bigger. There were a number of changes made recently to the food label, if you've observed that. One of them was the larger font for calories, and some of the products were updated as far as serving size to make it more realistic to what the individual would actually be consuming, which I think is good because then the numbers are accurate. So we want to look there first, and then we want to look if we're watching blood sugar. This is based on the premise that someone is watching their blood sugar. We want to look next at the carbohydrate line, and we want to look at total carbohydrates grams, right, in that serving. So this is 37 grams. And then below that, we want to kind of see what numbers are nested under that, which would include fiber, total sugars, and added sugars. So I already talked about fiber a little bit, and this has 4 grams. So that would be considered a good source of fiber because we know that 3 grams is sort of the minimum to look for. And then we want to look at sugars, and definitely we want to look at added sugars. So those would be things like, table sugar is added into the product, or even if you're at home and you're adding something like honey or maple syrup or any other sweetener that you have, in coconut sugar, there's so many different kinds, they are still considered added sugar. So even if it's considered more natural, we really want to be careful of getting too caught up in that and really still looking at the total amount of sugars. Hopefully that makes sense. The other thing that I just really quickly want to mention is I love to look at the percent values, because this really helps people have a sense of that particular food, how much is in that one food in contrast to the whole day. They often don't have a reference point. So people will say, 10 grams of sugar that's not a lot. And I'm like, well, based on what? We need to have a reference for what's your total for the day. So if we look over here, this has 20% of our daily value of added sugar. So if we ate 5 of these foods, we would easily be at 100% for the day, right? So that just helps you to have a reference point. So with that, if it's 5, like the saturated fat here, if it's 5 and under, that's considered low for that particular line item. So the saturated fat in this product is low. And if it's 20 and up, it's considered high. So that's just a really easy way to evaluate. Okay. So what are some high carb foods that affect our blood sugar? So this is just a list of some of the kind of the culprits that you might look out for. So I mentioned bagels in that quiz, and that's the first thing listed. I'm just laughing at that. So people often think of bread, but they may underestimate like, oh, it's just a bagel, right? Where you think of the quantity of carbs in a bagel, that's like 4 slices of bread approximately. So it's just a lot thicker and more. And there's some other things here. I mentioned cereal. That can really be a culprit. When I think it's not that cereal is bad per se, it's just that people are just really heavy-handed with how they're pouring their cereal, and they often are having 2 or 3 cups when the serving is maybe 1 cup. So, and the same can happen with pasta, rice, fruit juice. We know is very concentrated in sugars, even though it's natural. We want to watch that. And then, of course, most people know that our desserts, cakes, candies, ice cream, and things like that will have a lot of carbohydrates in them. We do also want to define which vegetables contain carbohydrates. So the starchy ones include corn, peas, and potatoes. those have carbohydrates as well. But there's a lot of vegetables that have almost no carbohydrates. So that's where we really need to define that.
That's a good question, Heidi.
Sure.
So you say to turn to more fruit in their whole form versus like dried, because you tend probably to eat more, right? Of like a handful of raisins is different than like a handful of grapes. What do you think about smoothies? So like if you make a smoothie with just whole, like, you know, frozen bananas, frozen strawberries, no sugar added.
Yeah.
Would that result though in a higher carbohydrate level, you think, than if you were to just eat those things raw? Like, I don't know, does it change its form in some way? Yeah. So like, yes.
It's a good question. I'm not sure. I mean, I'm
wondered,
sure
like you talked about the orange juice, right, being in juice form.
Yeah.
And how it gives you that.
I mean, the difference with the juice in that example is that it has no fiber at all. It's just a liquid form versus you're taking the whole fruit and blending it. So, I mean, it would be probably an interesting experiment for somebody who is checking their blood sugar. I always say that people that are not diabetic should do the experiment of just getting a meter and checking their sugar, right? Because most of us don't know where our sugar's at. I wanted to do that actually.
Yeah.
I asked about it when I was pregnant, but it was really complex, you know, to get a meter and all that. So it didn't end up happening. But, you know, to see, does that food raise your blood sugar faster than if you just ate the fruit? That would be how you
strawberries and a banana. Yeah.
I think just being aware when you're making the smoothie that you're not dumping too many things in it that really, like, it can be very healthy, but we still want to watch the quantities and just not overload it with maybe too much fruit. Sometimes I'll say just do a small piece of banana and then some other berries and lower sugar fruits. And certainly, you know, using water as the liquid instead of like orange juice, or you can use different milks or plant-based milks like almond milk, coconut milk, but just really watch what you're adding to it.
Thank you.
Okay. So, and just a couple other food examples that I have here. So we talked about cereal, but what about like granola? So this is our Nature's Promise granola. Anyone want to guess? Well, first off, what's the serving size of granola? And I mentioned that regular cereal would be about 1 cup. So this here, what do you think is the serving size?
Quarter cup.
Quarter cup?
That's what I think too.
So, you know, different products have different serving sizes on the label. So this does say 1/2 cup. It's a lot of calories. It's 270 calories in a 1/2 cup. You know, depending on how you were eating this, if you were just pouring a little bit on like yogurt, you might only have even 1 or 2 tablespoons versus putting it in a bowl with milk, right? So that's how I would eat granola. I would use it more as a topping, but in a 1/2 cup, anyone want to guess the number of carbohydrates?
40.
40. You're close.
Alex, what do you think?
I was going to say 35, but
35. So this has 43 carbohydrates. I don't know if you can see that. I'll try it. 43, and then the sugars is 14 total sugars, 13 grams of added sugar. So that's a lot. So these slides don't talk as much about the added sugar. I always like to just mention that because people ask the question, the amount of recommended added sugar, meaning like not to exceed, is about 24 grams for women in a particular day and about 36 grams of added sugar maximum for men. So if we had this granola and we had 13 grams of added sugar, that's more than half potentially the amount that we should have at maximum in a day. So that's just something to be aware of when you're looking at the labels. Another one I want to mention, like just real quick, condiments. Be careful here, right? So we have natural, you know, organic ketchup that might be nice, but 1 tablespoon is 4 carbohydrates and 3 grams of added sugar. So if you had like 3 to 4 tablespoons on your plate with your French fries or your, you know, hamburger, turkey burger, whatever, you would easily have, you know, about 12 to 15 grams of carbohydrate and at least, you know, maybe 10 grams of sugar potentially. So I had that conversation with my dad recently because he loves ketchup, right?
Now they make the no sugar added, and it has a different taste for sure.
Mhm.
I think there's still carbs in it, but there's no sugar added to it. It has a very has anybody tried it? Have you guys tried it? The no sugar
No.
added ketchup?
Sugar
It's
ketchup.
it's good. I like it. It's a little bit more tart.
Oh, absolutely. Sugar,
Yeah.
you know, is used to make things more palatable. But so just moving along, because I know I'm going to run out of time here. So a common question that we get is, do I have to give up carbohydrates? So no, you don't have to give them up. And certainly if you're on a medication that's impacting your blood sugar already, we do want to be careful of low blood sugar. I'm sure that you guys could talk in greater detail about that if we had the time. But if you are completely taking carbohydrates out of your diet, an individual could end up with a low blood sugar. So we want to have a moderate amount, and we want to choose things that are whole grain, like the oatmeal, obviously moderate portions of fruit, vegetables, and other things with fiber. And then we do want to choose more vegetables than fruits typically, because the fruits are higher in sugar. So, and definitely I've been mentioning the portion sizes a lot already. So how much carbohydrate per day is okay? So these are generic ranges. I always like to say, you know, this can be tailored very specifically, just like your medications are. You know, a dietitian can work with an individual to give them very specific parameters around how many carbohydrates, or a doctor. Our role as dietitians with Hannaford, we don't typically prescribe the diet, but we can give you general parameters, and then we can always help an individual who's been given direction by another provider on how much they should be having that's been individualized for them, and we can help them figure out what that looks like. So that's really where we work our magic in the store, is if they come in saying, my doctor told me I should be having 45 grams per meal, and I can help you figure out what that looks like, right? So what does 30 to 60 grams of carbohydrate look like in a given meal? There could be a lot of examples of this, but as I just mentioned, our granola has, you know, 43 carbs in a half cup. So it's not to scare you with this, but just to help you understand kind of how quickly they can add up if you're not paying attention to what you're eating. So we'll get into some serving sizes in a little bit. You know what, I want to actually stop the share and share another handout on this before I go through deeper into the slides. Hold on. Okay, so this is my, all right, can you guys see that? Do you know what one serving of carbohydrate is? So this list is based on one serving being 15 grams. So just to help you understand, if you are told to have 30 to 45 grams in a meal as a woman, you know, you can easily see how 3 servings of any of these foods would be about 45 grams. So one slice of bread is typically about 15, but read your labels, because sometimes really tiny slice or a much larger, like artisan type bread, might be 22 grams. So another example I have here, because this is a Hannaford product. These are pita breads, which are massive. As you can tell, they're very thin, right? So you might think, oh, that doesn't contain a lot of carbohydrate, but a serving is 1/2. This is like in the bakery. I might even have a third or even a quarter of this, because it's like bigger than my head here. So 1/2 of the pita is 58 grams. So yikes. But you know, you can see maybe you do a quarter and that's about 30. And if that's your sandwich for lunch, and then you're having, you know, some cut up carrots, or maybe you're having a little bit of hummus with your carrots. So I have hummus here. 2 tablespoons of hummus is 4 grams of carbohydrates. So like I mentioned previously, the beans do have some starch in them. As you can see, they're listed on the starchy vegetable category. But if you only had 2 tablespoons, that's 4 grams. So this is like budgeting for your diet, right? You might budget your finances, well, you can do the same with carbohydrates is kind of how I like to describe this. So I won't go into all these examples here for the sake of time, but you can see how, I'll just highlight a few on the grain column, the first column here, 1/3 cup of rice or 1/3 cup of pasta is 15 grams. Almost no one eats 1/3 cup. So I would say realistically, you'll probably have a cup and that would be 45 grams. Most people would have at least a cup of pasta or rice, unless you're really being diligent and watching your quantities and portions. So like I said, it's individual. You know, if somebody's really active, they may need more carbohydrates depending on someone's age. If you're talking about an adolescent versus a sedentary female in their 50s, you know, there's a really wide range here. So we do want to be careful not to be too general. So those numbers that I gave you, the 30 to 60 are really kind of generic, but they're meant to give a guideline. And I will send these handouts out so that you guys can have them for reference. All right, so I'll just go back to my slides here and just talk about a few more things before we finish up. So as it says, definitely meet with a dietitian to individualize this further. So are there any shopping tools to make this easier for you? And the answer to that is yes. So obviously Hannaford has dietitians like myself. There's over 30 dietitians across the company. We work in different stores. You can find our information on the Hannaford website under the Get Inspired tab. You can find our schedules, our emails. I do have a running email list that I send out what my classes are just for my stores. So most of us do that so that we can give you, if you're in our geographic region, we can send you what we're doing in the store, but you can also find that on the website. And then we have the Guiding Stars program, which makes shopping easier. So I want to talk about this really briefly because I know it is just about 5. We have this in our stores. It's very special. I think it's a very cool thing that Hannaford does because not all stores have this. And people ask us this question a lot. Can I find this if I shop at XYZ store? No, not necessarily. They may have it, but I haven't seen it in a lot of other stores. So this is a program that we work with. We didn't create the program, but we have it in the store. So we basically run every single food item in the store through this system. So unless it's pet food, as it says in the bottom, water, coffee, spices, alcohol, supplements, and medical foods are not rated. Everything else is rated in the store. So it's not just in the produce section or around the perimeter of the store. It's in across all the aisles, and every single product that is considered a food item would be rated with the system. So essentially we're the food is evaluated based on the nutritional facts panel that I've been talking about, and it's given a credit or debit if it has more fiber, more whole grains, good fats, and less of these things on the right, added sugars, added sodium, artificial colors. That was recently added to the algorithm. So we even include things like that. And a food would have 1, 2, or 3 stars depending on the nutritional value. And lots of foods have no stars. So I do want to mention that. I should say it's 0, 1, 2, or 3. So if you're looking for, if you're are considered someone with diabetes or pre-diabetes or anywhere in the spectrum, it's really a helpful tool because the fiber and the sugar, sodium, nutrients down below here, like our vitamin D and other nutrients in the food, are all factored into the Guiding Stars system. So it's going to help you as you try and find healthier choices. I will say the total carbohydrates is not one of our criteria because it's not considered one of the nutrients that they evaluate. If you look back here, we're looking at kind of the overall nutritional profile. So the vitamin content, the fiber content, we're not evaluating for whether it's a protein, carbohydrate, or fat. Those are kind of like, consider those the food groups. And then the stars is looking at the enhancements, like the nutritional quality, if that makes sense. So it is important to kind of weave in all the nutritional information that you're learning here and the STAR system together when somebody is watching their diet for their blood sugar. They do need to learn kind of the food label and the STAR system. And I like to weave those two things together so that they really have the tools that they need in their toolbox. So hopefully that helps. This is just showing you that where you're going to see this is right next to the price on the food. If it's a Hannaford brand product, it will also be on the package. So like this is Hannaford brand, but it doesn't earn a star. So it's not there. I'm trying to think about, oh, I do have an example here. So like our canned tomatoes, these better have a star. Oh no, maybe they don't have a star. I thought these were no salt added. Sorry. They don't have a star, I don't think, or it would be on the package. So I thought my husband had bought the no salt added. So that's actually a good example. This has a little more sodium, so I don't believe it earns a star, but it would be like right on the package if it did earn one. Oh, I know which one does. Sorry, I already showed you avocado oil, and there's the little star guy. All right. So these are just some other tips. Hydration is very important. I talked a lot about portions, and we can't also neglect the fact that stress can impact blood sugar. So of course it's important to exercise and find ways to reduce our stress as well. And this just talks a little bit more about that. For the sake of time, I just want to kind of end here. This is just to remind you, the website, hannaford.com/dietitians, is where you can find more information about myself and the other dietitians in our program. And if anyone has any questions, I am happy to stay on for a minute or two and answer anything that's come up. I know it's a little bit after 5, but I haven't been looking. Were there any questions in the chat that anyone had? No? Well, thank you for attending today. I know that I do believe we recorded this so that anyone who wasn't able to come on can hopefully access the information and hear what we shared today. Thank you guys all, Cheryl and the student, our pharmacy students here. You guys have a wealth of knowledge and information, and it was great to have this collaboration together. So hopefully it was a good experience for you guys to come on and do this today.
Yeah, thank you for having us.
Thank you. All right. Well, have a good night, everyone. We can sign off here. Bye, guys.
Okay, thank you. Bye.
Thank you. Bye.
Thanks, Heidi.
Thank you. Thanks for hosting, Leanne.
No problem.